optic nerve head hemorrhages or optic disc hemorrhages. Optic disc hemorrhages have also been known as Drans hemorrhages, and giving credit to the scientist, Professor Steve Drans, that worked the greatest in this area. And so people called it, people also refer optic disc hemorrhage as Drans hemorrhages. This particular picture is to point out that optic disc hemorrhages could be so subtle that even, this is a much older picture and cameras have improved much more beyond this, but even though the cameras have improved, optic disc hemorrhages are very difficult to identify. They may look like a small capillary that is present. If you don't pay very close attention, you will easily miss these optic disc hemorrhages. These hemorrhages tends to be on infratemporal and supratemporal regions generally, or majority of the part. Doesn't mean that it has to be isolated to only that region. Now these hemorrhages, optic disc hemorrhages, tends to be flame-shaped because they tend to follow the path or they spread towards in the shape of the nerve fiber bundles. So in this arrow, it's so difficult that you can't even tell. If I took this arrow off, you won't be able to tell where the disc hemorrhage is. And the point is to just show that it could be very subtle. Now in this picture, the optic nerve head, optic disc hemorrhage is very obvious. You can see the big juicy one here, and there's a fellow eye of the same patient showing another hemorrhage right here. Now this is pretty easy to observe, but if this starts getting absorbed, which it will become very small and it may look like a capillary, or it could be easily masked around the background color of the fundus. Older theory used to suggest that optic disc hemorrhage is the region where you would see a future progression in glaucoma. So here's an example of a picture of a patient that had a hemorrhage in a particular region, and 3 years later, they developed a notch right about there. Now we know that individuals with optic disc hemorrhages are common. Glaucoma patients get them often. And if you do have a hemorrhage, you should treat the patient with a little more suspicion and watch out for nerve fiber layer changes around the optic disc. It could occur anywhere. It doesn't have to be limited to the region of optic disc hemorrhage only. So if you take primary open-angle glaucoma as a slow progressive disease, a primary open-angle glaucoma patient with an optic disc hemorrhage tends to be slightly faster progressing or slightly more rapid progressive disease when compared to its other counterpart that doesn't have a disc hemorrhage. It usually, on average, patients with optic disc hemorrhage tend to progress in about 2.5 to 3 years when compared to primary open-angle glaucoma, which could usually take around, when under appropriate care, it takes about 7 to 10 years to progress in glaucoma.